Welcome back, my good people, and in this video we are going to learn more about headache, causes and types. We are going to look into details the subtopics of types of headache, and we are going to learn about clinical presentation, that is signs and symptoms about all these types of headache. If you are a new subscriber here, thank you so much for joining. Click this notification bell, written subscribe, turn it on for more videos that I will post. And if you are returning subscribers, thank you so much for coming again and clicking this video. Kindly like the video, put some comment here, and even share it to your colleagues and your friends. Now let's jump into the video and learn more about headache. Headache, types and causes, and this is part 1, presented to you by me, Dr. Pamli. Now, when we define headache, we should be able to know that it is also called cephalalgia. Symptoms of pain in the face, head or neck. It can occur as a migraine, tension type headache, or cluster headache. There is an increased risk of depression in those with severe headaches. And there are more than 200 types of headaches. Some are harmless and some are life-threatening. The description of headache and findings on neurological examination determine whether additional tests are needed and what treatment is best. Now, headaches are broadly classified as primary or secondary types of headache. Now, primary headaches are benign, recurrent headaches not caused by underlying disease or structural problems. For example, migraine is a type of primary headache, while primary headaches may cause significant daily pain and disability. They are not dangerous from a physiological point of view, while secondary headaches are caused by an underlying disease. So we should be able to note that. Now, primary headaches, 99% of headaches are primary headaches. Primary headaches usually first start when people are between 20 and 40 years old. The most common types of primary headaches are migraine and tensional types of headache. Now, migraines, patient will present with moderate to severe pain and duration of 4 hours to 3 days. Periodic occurrence, that is several per month to several per year, located on one or both sides of the head. They are pulsating and throbbing in manner, and sometimes there might be nausea and even vomiting. There's something we call an aura, and an aura is a perceptual disturbance. For example, if it is experienced by somebody with epileptic, or when you are having a migraine, and epileptic aura is a seizure, but in migraine it can leave you with disorientation, or you can even get confused. Tensional headaches are mild to moderate dull or aching pain. Duration is simply short, 30 minutes, or it can last several hours, located as tightness or pressure across the head. No nausea or vomiting, no aura. It is sometimes very, very uncommon, but light sensitivity or noise sensitivity is very, very uncommon. Now, cluster headaches present with severe pain, duration of 30 minutes to 3 hours, may happen multiple times in a day or months, located on one side of head, focused at eye or temple. The temple is a latch where 4 skull bones fuse, the frontal, parietal, temporal, and sphenoid. It is located on the side of the head, behind the eye, between the forehead and the ear. The temporal muscles cover this area and is used during mastication. So we are going to look at the pictorial nature of the temple so that you can be aware. Otherwise, there is pain describable as sharp or stabbing and may be accompanied by running nose, tears, and dropping eyelids, often only on one side. So when you want to know what temple is, that is the diagrammatic nature of the temple, and those are the bones that we are talking about, the parietal, occipital, frontal, and now where they fuse together, that is where we have what we call the temple. Now let us continue. Trigeminal neuralgia or occipital neuralgia, this is a shooting face pain, and hemicrania continua is a continuous unilateral pain with episodes of severe pain. Hemicrania continua can be relieved by medications such as indomethacin. Primary stabbing headache, a recurrent episode of stabbing, we call them ice pick pain or jab and jolts for 1 second to several minutes without autonomic symptoms, that is tearing, red eye, nasal congestion. These headaches can be treated with indomethacin again. Primary cough headache starts suddenly and lasts for several minutes after coughing, sneezing, or straining, anything that may increase pressure in the head. Serious cause we may discuss as secondary headache and red flag section that we'll discuss in another video. They must be ruled out before a diagnosis of benign primary cough headache can be made. Now, primary exertional headache, these are throbbing pulsatile pain which start during or after exercising, lasting for 5 minutes to 24 hours. The mechanism behind these headaches are unclear, possibly due to straining causing veins in the head to dilate, causing pain. These headaches can be prevented by not exercising too strenuously and can be treated with medication such as indomethacin. Primary sex headaches, these are dull bilateral headache that starts during sexual activity and become much worse during orgasm. These headaches are thought to be due to low pressure in the head during intercourse. It is important to realize that headaches that begin during orgasm may be due to subarachnoid hemorrhage, so serious cause must be ruled out first. These headaches are treated by advising the person to stop intercourse if they develop a headache. Medications such as propranolol and diltiazem can also be helpful. Hypnic headache are moderate severe headaches that start a few hours after falling asleep and last 15 to 30 minutes. This normally affect many people. These headaches may recur several times during the night. Hypnic headaches are usually in older women, so geriatrics. They may be treated with lithium. So if you have an old mama who is having frequent headache during sleep, kindly bring this person to the hospital for further evaluation and further management. Now, secondary headaches, this may be caused by problems elsewhere in the head or neck. Some of these are not harmful, such as cervicogenic headache, pain arising from the neck muscles. This may be relieved by just some massage on the neck. The excessive use of painkillers can paradoxically cause worsening painkiller headache that we are going to discuss. But most serious headaches of secondary headaches include the following: meningitis, that is inflammation of the meninges which present with fever and meningismus or stiff neck. Bleeding inside the brain, that is intracranial hemorrhage, subarachnoid hemorrhage or acute severe, presenting with acute severe headache, stiffness without fever. So this one we can really take serious, and most cases these patients are admitted. Ruptured aneurysm, arteriovenous malformation, interparenchymal hemorrhage, presenting with headache only. Brain tumor, this is also a very serious disease that must be elicited by MRI or even CT scan, but normally start with dull headache, worse with exertion and change in position. So whenever you have a headache, whenever you change position, you try to walk, you try to do something, the headache is worsening, and it may be accompanied by nausea and vomiting, and often the person will have nausea and vomiting for weeks before the headache starts. So this one might be elicited, as I've said. Temporal arteritis, inflammation disease of arteries, common in elderly, average age 70, with fever, headaches, weight loss, jaw claudication, tender vessels by the temples, polymyalgia, rheumatic. So these are some of the types of secondary headache that you should know. As we continue with secondary headaches, we have acute closed angle glaucoma, increased pressure in the eyeball, a headache that starts with eye pain, blurry vision, associated with nausea and vomiting. On physical exam, the person will have red eyes and fixed mid-dilated pupils. So not all red eyes are conjunctivitis, and this particular patients need to be examined thoroughly in the eye clinic to elicit more causes of this. Post-ictal headache, that headache that happens after convulsions or other types of seizures, as part of the period after the seizures, that is post-ictal state. So patients with high fevers can convulse, or even epileptic patient. So we may do a lot of history to elicit whether this is post-ictal headache. Gastrointestinal disorders that may cause headaches, including Helicobacter pylori infection, celiac disease, non-celiac gluten sensitivity, irritable bowel syndrome, inflammatory bowel disease, gastroparesis, hepatobiliary disorders. The treatment of the gastrointestinal disorder may lead to a remission or improvement of headaches. So this one also we might treat them case by case by even doing a Helicobacter pylori test, and sometimes we might do ultrasound, MRI, or even CT scan of the abdomen, or even barium meal or barium swallow to explain further. Medication overuse headache. This is caused by chronic and excessive use of medication to treat headache. So when you abuse painkillers, these painkillers might turn to abuse you back. So we should be able to stick to prescription and to stick to the hours that those drugs are taken. Is most common secondary headache disorders and may affect up to 5% of some populations. Women more than men are affected. It occurs by definition of more days than not, is oppressive, persistent, and often at its worst on awakening. So when we are using medication to deal with headaches, then we should be able to take care of ourselves not to overuse this particular drug. Thank you so much. And if you feel that you have Helicobacter pylori, or you have symptoms that might depict Helicobacter pylori, that is you are presenting with epigastric pain, bloating, feeling of fullness of the abdomen, or even abdominal pains, kindly click that video that appears up here and make sure you watch to be well conversant with Helicobacter pylori. See you in the next video as we discuss a part 2 of headache. This is a place that it is now interesting that we are going to diagnose a headache and go ahead and treat this particular headache as case by case. Muchas gracias.